A deal has emerged out of the Senate Finance Committee to reauthorize the Children's Health Insurance Program, but it's not law yet. I'm Brynne McBride of ABC for Health. Today, we're looking at that tight timeline the Senate has to reauthorize the Children's Health Insurance Program before it sunsets on September 30th. Now, this Children's Health Insurance Program, which we call CHIP, provides health coverage to children and families with moderate to low incomes. In Wisconsin, it's wrapped right into the Badger Care Plus program, which allows Badger Care Plus to cover children up to 306% of the federal poverty level, a little enhanced eligibility over the traditional eligibility that otherwise for Medicaid rides right at the poverty line. Now, this reauthorization sunsets September 30th. Senate Finance Committee has taken it up, and they've come to what they believe is a deal. Now, there were a lot of variables at play. There was a fast timeline. The last time this was reauthorized, they set September 30th, 2017 as the date when the Senate would have to either refund and reauthorize it or let it sunset and just disappear into the ether. Now, Senator Orrin Hatch and Ranking Member Ron Wyden out of Oregon have both a bipartisan effort said, we support the Children's Health Insurance Program. We support reauthorizing it. But the other variables at play is whether you can get a very contentious Congress to agree, whether there'd be writers on this and other little tag-alongs that would make this a little bit more contentious and not as easy of a passage as people first thought. Also, what about some of those enhancements that the Affordable Care Act added to the Children's Health Insurance Program? Would there be extensive debate on those elements? Well, we're going to talk about the deal that the Senate Finance Committee made first and then speculate about what might happen in the full legislature. Like we said, what came out of the Senate Finance Committee is a deal, but it's not legislation yet. Here's what the deal looks like. As for that extended enhanced federal match, when the Affordable Care Act was passed, they said that they would add 23% enhanced federal match to the states for their CHIP program, for their Children's Health Insurance Program. More money going to the states from the federal government. Believe it or not, that was a contentious issue. It also included maintenance of effort requirements, which means you can't cut eligibility for children, especially with that enhanced funding, when times get tough. If you're starting to run into economic downturn in your state, that is not the time to cut eligibility for children. Those were the provisions of the Affordable Care Act. Now, senators on both sides of the aisle largely embraced these enhancements. Others did not. As it stands right now, the deal said, yes, we're going to leave those enhancements, but we're going to phase out that federal match over the next 5 years. That was a compromise that the Democrats on the committee were willing to live with, and so that's what came out of committee. Yes, reauthorize CHIP. Yes, keep the enhanced federal funding for the time being, the next couple of years, and phase it out by 2021 back to normal funding levels for CHIP. Maintenance of effort so far seem to be still on the table at the same level as before. Now, originally under the Affordable Care Act, maintenance of efforts requirements were set to sunset by 2019. It looks like they shall continue at least on the regular timeline and maybe be continued into 2021. The devil will be in the details on that particular requirement. Sticking points for Congress. So this is the deal coming out of committee. It now has to go to the rest of the Senate and be voted on. And once again, those sticking points will be that enhanced federal match. Whether or not maintenance of effort requirements get added in and left in for a duration of time. Add-ons, like what if there was a provision about continuing cost-sharing reductions or other that for some reason seem to be very contentious provisions of the Affordable Care Act? What if that's tagged onto this legislation? You can take something that is otherwise bipartisan and something that most legislators agree is a good idea to pass, like the reauthorization of CHIP, and you could kill it with one of those add-ons. In this polarized political environment, any one of these things could derail this CHIP reauthorization. So what happens if it doesn't get reauthorized? Well, there are about 4 states that said, well, then we'd run out of federal money to run our CHIP program by the end of the calendar year. 31 states would run out of money by the end of the first quarter in 2018. Some states said if they do run out of money, they're either going to be cutting back benefits, they're going to be creating waiting lists, or they're going to have to somehow figure out how they might be able to squeeze some kids onto their traditional Medicaid rolls, but that's no guarantee. The consequences will be dire, and we're talking about 9 million children nationwide that benefit from the CHIP program. So the consequences would be big. People are encouraged to call their legislator and argue that CHIP is a good idea, reauthorization is in the best interest, and keeping in mind that the Senate has a lot of other things on their mind right now. They're pushing the Graham-Cassidy bill to repeal and replace the Affordable Care Act. That is getting a hearing in front of the Senate Finance Committee in the coming days, which could take a lot of air out of the room and a lot of attention away from the Children's Health Insurance Program. So it's a good idea to bring it back up to the forefront, put it back in front of their attention to make sure that it doesn't get missed. You can read more about the Children's Health Insurance Program, some of that Senate Finance Committee statements on why CHIP and the deal is a good idea, and articles of interest, especially from the New York Times, that give us a little bit more perspective on what's at stake if CHIP actually does not get reauthorized. You can share your Badger Care Plus or Medicaid story or your Affordable Care Act story by clicking on that information button or sending us an email. If you're watching us on YouTube, you can like or share or go ahead and subscribe to our channel. Thanks for watching.